All right, hello everyone. Thank you for joining us on the closing keynote we have here. Before I get into the meat of the discussion here, I'd like to introduce myself. My name is Brian Meyer. I'm with Health Management Associates in our Tallahassee, Florida office. And with me here, I'm joined by the Secretary of the Agency for Healthcare Administration, Jason Weida. It gives me great pleasure to introduce this gentleman to you, a man I'm sure many of you might be familiar with in some capacity already, but I want to give Jason the opportunity here to introduce himself, tell him a little bit about you, and then just kind of get into some discussion about what are the agency's priorities, upcoming priorities in the next year.
Great. Thank you, Brian. Thank you very much for having me. I've been looking forward to coming down here and talking with all of you. It's great to see so many friends in the audience, to make new friends tonight, and to see my old colleague, Brian. Brian, I have known since my first day at ACA, really, when we sat just down the hall from him when we both served as assistant deputy secretaries in the Medicaid program. So it's good being back with you, Brian. So I've been secretary at ACA now for, I don't know, a year and a half, 13, 14 months, something like that. Before that, I was the chief of staff, and then, as I mentioned, I was an assistant deputy secretary in the Medicaid program. Been doing that for about 2.5 years, moved down from the Northeast, where I served in the Department of Justice, doing mostly healthcare litigation, and then in private practice before that. So that's the very quick intro.
All right, great. Well, thank you. So most people in this room here are familiar with ACA, Agency for Healthcare Administration, in some form or fashion. But it's possible, but ACA does a lot, has a breadth of responsibilities across the healthcare landscape in Florida. Could you give us a bit of a discussion about what those roles are and how important ACA is in the Florida landscape environment?
Yep. So I think one way to kind of demonstrate, and I think pretty much everybody here knows all this stuff, but just for the benefit of the few people who don't, one way to put this into perspective is just to talk about ACA's budget. We have the largest piece of Florida's budget. It's about $37 billion. But we do a lot more than just Medicaid. Of course, we have a very robust Medicaid program in the state. We're primarily managed care. We're responsible for that. We're the chief planning and policy agency for healthcare in the state. And we also license and regulate hospitals, nursing homes, assisted living facilities, all sorts of clinics, pretty much everything except for a doctor's office. So there's a lot of stuff that falls into the purview of the Agency for Healthcare Administration here in Florida. It's my true honor. And I'm grateful to the governor and others every day for being able to sit here and do this role, to have made the great friends that I've made in Florida, and to work with a bunch of talented people, many of whom are in the audience right now.
So you're probably correct that most people are familiar with the main roles of ACA. Is there any little known fact that might not be well known of ACA that you would like the audience to be aware of?
Oh gosh, an unknown fact about ACA. Well, it may not be unknown, at least to some of you, but one of the great things about our agency is that we have some folks that have served in the agency for 20, 25, almost 30 years, and have stayed in their public service roles at ACA for that entire time. And that is the case in other agencies too, but we are blessed to have folks like Kim Smoke, to have folks like Kristen Sokolowski and others in the agency with the institutional knowledge that remember what the healthcare landscape in Florida looked like before managed care. And to have that institutional knowledge is very helpful, because I feel like a lot of arguments tend to it may seem novel at first, but they usually are just like a nuanced version of a previous argument that's been made in the past. And having that kind of institutional knowledge is very helpful, because it allows you to analyze issues as they come up and proposals and say, well, that's kind of like what we did 12 years ago, and that didn't work for the following reasons. Having people like that on your team is invaluable. So I'm very grateful to the people in our agency that have agreed to be public servants for that long, because if you think about it, some of these folks, like, we do very sophisticated work at ACA. I mean, you can't just pull somebody off the street and expect them to do a demo waiver application. I mean, these are very sophisticated people that could be making a lot of money in other private sector roles. And so to commit to working at ACA for that long is something that I am very grateful for, and rely on those types of folks every day.
Thank you. Kind of changing gears here a little bit. A few weeks ago, ACA announced the award of the new contracts for the upcoming statewide Medicaid managed care contract period that's going to run through 2030. I understand that that process is not completely finalized, and there might be some restrictions around what you might be able to say around that process. But what can you tell us are some of the key priorities that the agency was trying to accomplish through this procurement?
Yep. No, happy to. Yeah. So that's. This is something that we were working on for quite some time. The awards were announced publicly fairly recently. There's a process that needs to play out. That process is not over. That process is still ongoing, will be ongoing for some time. But when we, just to go to answer your question, when we were creating or drafting the intent to negotiate, we obviously spent a lot of time thinking about what we were going to put in it, because that really sets the tone for the types of plans and the types of and the negotiation that's going to happen during that process. So we put a lot of time and thought into it about what are our key priorities in the state from a healthcare perspective, and some of them are really kind of obvious, but we did put a lot of thought into it. One is outcomes for moms and babies. That is incredibly important to me, to my agency, to the governor, to the first lady, to everybody in Florida, frankly. And so that is something that we put a lot of time and effort into thinking about how we could increase those outcomes. The other is childhood and adolescent mental health. I mean, we have a mental health crisis in this country, and we want to figure out how we can use the Medicaid program. Can everyone still hear me? Yeah, okay, good. How we can use the Medicaid program to make that crisis either go away or to improve outcomes and allow kids and adolescents to live happier, healthier lives. So that's something that we're very, very focused on. So those are two big ones. The third one, and there are more. I mean, there's a ton of things we were trying to do with this procurement, and you can't really distill it into a couple of talking points. So, but one of the other initiatives you probably read a lot about, Hope Florida, that the First Lady has been working on, and we tried to incorporate a lot of those concepts into the ITN. Really, we spent a lot of time writing about that in the ITN. I'm sure many people in this room have read the ITN before, if not hundreds of times, perhaps. And so you're very familiar with that language. But the key really is to promote economic self-sufficiency. And obviously, there are people that will need Medicaid their entire their lives, or at least for a certain period of time, that do not have the ability, never will have the ability to get off Medicaid. We understand that. But there are people that, with a little extra help, probably can go down the path toward economic self-sufficiency, and we felt it important to provide them with a pathway for that, and where possible, to break these cycles of poverty, to improve people's lives. And it's very complicated to do that, but we spent a lot of time thinking about how we can incentivize plans and others to achieve that goal, and we are very optimistic about that going forward. So those are kind of three top level things that we're focusing on. But you're absolutely right. There's a whole bunch of other things I'd like to talk about, but probably with the process as it plays out, probably need to hold that until the end.
Great, thank you. And while the announcing of those awards was certainly big news, it's not the only big news that the agency has received this year. I remember earlier this year, Florida became the first state in the nation to have its Canadian drug importation program approved. I was hoping you could kind of tell us a little bit about this, where we are in the process, what are the next steps, and what do you see ultimately envision the program becoming?
Yeah, that was great news. I want to back up a little bit and talk about it. So I think a lot of people think that drug prices in this country are way too high. And we want to do, listen, we're a state. We're, I think, the best state in the country. But at the end of the day, we are a state. And so we cannot solve the drug price problem in this country ourselves. But by God, we're going to do what we can. And one of the things that we have been focusing on is the Canadian Prescription Drug Importation Program. And that is something that was passed under the leadership of Governor Ron DeSantis and former Speaker Jose Oliva. And when I got to ACA, we have the program that we had been applying to the FDA. That program happened to fall into my portfolio when I was an assistant deputy secretary in Medicaid. And when I was getting up to speed on what was in my portfolio when I first started, I remember getting briefed on this, and I said, "This is a really cool program, but nothing seems to be happening because the FDA is essentially stonewalling us and did so for a long time." And in working with leadership of the agency at that time and others, we decided ultimately we had done everything we could to prod the federal government along, and so ultimately resorted to a federal lawsuit, which was something that, having worked at DOJ in private practice, was something I was quite familiar with. So I felt very much at home proposing that and finding good lawyers to work on it. And that began I think it was a year and a half of litigation that was pretty hard fought, and it ultimately resulted in, I think, at least played a contributing factor, a role in the FDA approving our application for a prescription drug importation program from Canada, which was the first in the nation. Many states had applied before. We were the first to apply. Other states had applied. Their applications languished or didn't succeed. We were the first to be approved. Now, that was really just the first step in the program. And right now we are working very closely with our vendor, Life Science Logistics, and others to negotiate with Canadian wholesalers, to interact with the Canadian government, and to make this program successful. Now, it's a really complicated issue because this is a very sensitive political issue in Canada. It is a very sensitive issue for big pharmaceutical companies who, for a variety of reasons, don't want it to happen, or at least don't want it to happen in the way that we have proposed. And so those are the two obstacles that we're currently dealing with. But we are working just as hard now as we have before, and are looking forward to having this program be a success and to have it result in savings for the state, and to see where it goes and what happens with the conversation, what impact it has on the conversation in this country to help lower the cost of drugs. So I view this as really just the beginning. It's a conversation starter, but it's something that's really important that we've dedicated a lot of time and effort into.
Is the agency looking at any other initiatives or projects to kind of still help to build on prescription drug importation, also to help improve transparency around prescription drug pricing, lowering costs? Are there other initiatives that you envision coming to fruition in the future?
Yeah, so first of all, I know that there was a panel on drug affordability. I was not able to make it because I was a little bit delayed. If anybody has any ideas they want to pitch to me, come see me after, because we are all ears when it comes to lowering drug prices in Florida and around the country. So I would be happy to entertain any idea, no matter how crazy, and bring it back and see if we can do something with it. But we have a lot of ideas. Canadian drug program is the kind of most concrete thing we're working on right now, but there's a lot of other ideas floating around. I think one of the key things that we're doing in the space, in addition to the Canadian drug program, is our transparency initiatives. I think once it becomes clear, well, first of all, we want Floridians to know how much drugs cost. We want Floridians to know how much procedures cost around the state, so that they can make informed decisions about where to have a procedure, what drugs to buy. We think transparency is a good thing. We are actually, after all, the Sunshine State, so we believe that a little sunshine is always a good thing. So we work very hard on a lot of different websites that we have in our agency. I encourage you, if you haven't already done so, I know many of you do, look on our website, look at the different transparency initiatives we have for drug pricing, for other things. We spend a lot of time thinking about these things. There are a lot of smart people at the agency that are working on these things to make them more user-friendly. We work very closely with our partners in the legislature on this issue. I know there's a number of legislators who care very deeply about transparency. Chair Garrison is one of them. There are many. Senator Burton, who was speaking earlier, also cares about transparency. There's a lot of folks there that also are partners with us in this effort. So that's another item that we're working on that issue.
I'm going to change gears a little bit here, and we certainly want to save some time for some questions and Q&A afterwards. But one last topic, excuse me, as we head into June, is the start of the upcoming hurricane season and emergency preparedness. And I admittedly heard on the news this morning that we're supposed to have a potentially record-breaking hurricane season this upcoming year. So I was a little out of the loop on that, but it kind of feeds well and dovetails well into this topic. So what would you like, or what message would you like to instill upon the healthcare community as to how best they can prepare for the upcoming hurricane season, or really any natural disaster?
So that's a great question. Thank you for bringing that up. So I think, we do a lot of important things at the agency. We have a lot of lives in our Medicaid program. We regulate a lot of facilities. But at the end of the day, one of the most important things we do is plan for and respond to emergencies. The state has a great leader in Kevin Guthrie, who's the head of DEM, and all of his team. We work very closely with his team and our partners at the Department of Health because we license and regulate all of these facilities throughout the state. And, a lot of these facilities are right on or close to the water in flood zones. And we need to do everything we can at ACA to make sure that those folks receiving health care, those patients, in residential settings or hospital settings are safe in emergencies. So we work very hard. Kim Smoke, Deputy Secretary at ACA, plays a really leading role. She's sitting there in the Emergency Operations Center along with some of our other team working directly with DOH. I don't think a lot of people understand how much time and effort we spend on hurricanes. A lot of people think it's just DEM or just DOH. We're right there at the table with DOH. And a lot of those folks rely on our subject matter experts during emergencies. And I really saw that during Hurricane Ian, which was my third week as Chief of Staff. I had a nice cozy job in Medicaid, minding my own business, and I'm thrown into the Chief of Staff role, and 3 weeks later we have Hurricane Ian. So I saw the work that Kim Smoke and others are doing, and it is, really, Kim and her team, they save lives every hurricane, no question about it. So that is one of the most important things we do, and it is a team effort. I think a lot of people around the country look to what Florida is doing for emergency response, and the folks here that do that work are leaders throughout the country and the world on responding to hurricanes. And so it takes a lot of people to make that happen. And it's not just state agencies and state leaders. It's also the folks in this room and elsewhere that are a piece of the landscape of the healthcare architecture in the state. Everybody has a role to play. We work very closely with the associations for nursing homes and hospitals. We have planning calls in advance of hurricane season. The managed care organizations play a very important role. I've always been very moved when we have a hurricane, which is obviously devastating and people lose lives, and it's awful. But to see people come together and to see the work that everybody here, the plans are doing to respond to that has always been very moving to me. And so everybody chips in and acts selflessly to respond to these emergencies. So everybody has a role to play. If there's something anyone in here thinks could be done better, or if you think you can add value during a natural disaster, just call me or call Kim Smoke, or let's have a conference call or a meeting where we can talk about it. Because at the end of the day, we just want to make sure that it's just a matter of when we have another Category 4 or Category 5 hurricane, that we do everything we can to minimize the loss of life in the state. That's one of the things that, there's not a lot of things that keep me up at night, but that is one of them. So we want to be good partners with everybody here.
Great, thank you. I know we did want to leave a few minutes left for any questions that the audience may have. So if there are any, I think we might have microphones out in the audience that can come to you.
Don't hold back, I'm ready.
All right. Well, I got one more
Yeah,
topic
sure.
then, and maybe somebody will come up with a question. So, the opening keynote here spoke a lot about Live Healthy.
Yeah.
And a number of the initiatives and programs that were in that legislation are going to be implemented, or the Agency for Healthcare Administration will be very much involved with. Could you speak a little bit as to how you're preparing for that as the agency, what you envision, how those programs are going to roll out, and then ultimately the ultimate effect of those programs?
Yeah, that's a great question. So, I'm sure everybody here is familiar with Live Healthy and all of its component bills, and but if you're not, I'll take a step back. When I was going through my confirmation process, in, I don't know, a year and a half ago, I remember meeting with the Senate President, who I had not yet met, and the first thing she says to me is, next session we're having a healthcare session. And I was immediately terrified. I was like, what does this mean? What is going to happen? I just want to be confirmed, and maybe we can talk about this after. And true to her word, she had a seismic healthcare session, and we worked very closely with her as an agency and her team and folks in the House to try to think of ways that we can make healthcare better. And we had some ideas, some bills that we were thinking about running as an agency, and we spoke with her and her team, and some of that ended up being incorporated into Live Healthy. But one of the things that we think a lot about at the agency, and that the legislature has felt is very important, is the workforce for healthcare. I mean, the state, everyone knows Florida has always been a great state, but is getting better by the day. And more people are moving here, which means we need to have an appropriate workforce. We need to have doctors. We need to have nurses, especially as our population ages. And so we need to be doing things now to make sure that in 10, 15, 20 years, even beyond, that Floridians are going to have the access to the great health care that they deserve. And so that's something that we worked very closely with them on. Making sure doctors have great residency options here in Florida, and that they stay in Florida. And we want that to be, we want to have similar programs for nurses, for dentists. So we kind of really did a lot of outside of the box thinking. And what I told everyone is, listen, our agency is, we're busy as heck. There's a lot of people that are doing very sophisticated work that are working very long hours. But I told everybody, I was like, listen, bring it on. If there's another waiver that we can seek that's going to make this stuff possible, we'll do it. We'll hire more people, do whatever we need to do to implement some of this really creative thinking for how we can make healthcare better in the state. So we're all excited for Live Healthy. And the implementation process, to go back to your initial question, really started before the bill was signed. I mean, we had projects teams ready. They're working right now because it's a big lift for our agency. It's a huge lift. There's going to be multiple authorities we need to seek from the federal government. There are councils that we need to appoint people to. There's all sorts of really new and exciting and fun things, but this takes a lot of work and it's going to take time. But we are working our tails off to make sure that we can implement Live Healthy in a timely and appropriate way.
Very good.
There's really no questions?
I was going to open it up one more time. There was quite the entourage around him up here earlier, so.
Jason, you were saying workforce providers. Is there another workforce that's below that and support them?
Below doctors?
Yeah, and have you seen anything in Amsterdam that you would pull in from that trip?
yeah, so we had spoken about my trade mission to actually, this would actually be a better answer to, well, not a better answer, but another answer to what's new and interesting about ACA.
Should we do a redo?
Well, I'll add a second point, which is Alex Kelly had asked me to go on a trade mission, which is something that ACA secretaries don't typically do. I mean, it's really like a business development thing. The Secretary of Commerce or other people get to do these really fun trips. But because this was a healthcare-focused trade mission, he asked me to go along. And not only did I have a great experience, but we met with a ton of folks over there that are, startups, hospitals, that are really doing incredible work in a whole bunch of spaces that are really important to the state and where we think the state is going, transitioning from an ag, tourism, I guess space has always been a big part of Florida, into a state with a very sophisticated workforce that is focusing on life sciences, biotech, all sorts of things like that I think really add value and make the state economy what it is today and where it's going. I mean, I think we're either tied with or beat Spain for GDP if you look at Florida as a standalone country. So it's really incredible what we're doing and where we're going. But yeah, I think there's a lot to learn from other countries. I mean, obviously we have our own system. Our system is unique in many ways. But I think the value of doing things like that is that you get to see what other people are thinking, and that can always kind of influence the decisions that you're making. In terms of workforce in particular in Amsterdam, I didn't dive that deep into the folks I was meeting with in Amsterdam. But yeah, I mean, listen, at the end of the day, it's you can't just be myopic in who you're trying to help in terms of workforce, right? Because if you have a whole bunch of more doctors, there's a whole support network that goes around doctors and doctors' offices. That's the case for a lot of professions, that you need to make sure that you have the folks there that can make that happen. And I was meeting with some folks in South Florida who were talking about housing. That's also a part of the workforce equation, is that you want to have all these great workforce initiatives, but where are people going to live? Is there appropriate housing for them? There's a lot of housing in South Florida, but some of it's out of reach for some people. So you have to make sure you're thinking about all those things. Now, a lot of that is outside of my wheelhouse. We have a housing pilot, but I'm not really in the housing business. So these are things that other state agencies and stakeholder groups and others really all need to come together on and figure out a solution. And this is part of the kind of partnership concept that I was talking about earlier. But yeah, that's important. I mean, this is kind of a holistic approach to workforce. And we at ACA are just, at the end of the day, playing what is, from a high level, a small role in this. We think it's an important role, but it's everybody coming together is going to be able to solve this problem.
Oh, we have another question.
Hi, Carol.
Hi, Mr. Secretary. Good afternoon. So you said two things. One, you said you would be interested in entertaining crazy ideas. And the other thing you said was you brought up emergency preparedness. And those threads caused me to remember after a recent hurricane event when ACA reached out to the health plans, and in less than 24 hours, we all showed up at a remote location in Taylor County with truckloads of resources and services and tried to do our bit to help. And that demonstrates ACA's ability to facilitate resource movement and operations, and the plan's willingness to contribute to state objectives. And I just think that also Senator Burton mentioned this morning that she thinks a lot of times people don't know where to go to get services or help, don't even know where to begin asking. So maybe ACA could organize pop-up access points, mobilize resources in any community where they wanted to show up, to be in a little group in a little park, stand around and make services, products, resources available to the citizens of Florida so they can find their way into the healthcare system, get access to services, and get better outcomes.
Thank you, Carol. That is a great idea. So I have the person for you. So we just hired a new comms director at ACA. I don't know if anyone has had a chance to meet her or work with her yet. Her name is Alicia Collins. She was the communications director for Director Guthrie at DEM immediately prior to her current role. So she's obviously doing all the Medicaid 101 videos, so she'll be up to speed on Medicaid, but she has a lot of emergency response experience and background. And I think I would love to put you guys in touch to talk about that, because we're always looking for ideas, and I think she would be the perfect person to do that. But actually, what you mentioned about Taylor County is what I was thinking about earlier when I said I was being moved by what a lot of the plans are doing, because there's no requirement that the plans or anyone else respond to a call like that to help, and it has always been very meaningful to me to see the plans, the different trade associations, everybody, just individuals. I mean, before we went there, I sent an email out to everybody at ACA with on a Friday night, because I think the event was on Saturday, on a Friday night, saying, who wants to come with me in my truck and just help out? I have no idea what we're going to be doing. I got a bunch of people. We all drove down and helped out for an entire Saturday on a weekend. People in the agency from all different divisions I had never met before, and it was great. So just to see, and this is not unique to ACA. This is not unique to Florida. I mean, people come together in these things, and it's great. But you love to see it, and I appreciate the work that everybody does, because it's very important. But I'll get you in touch with Alicia, and we can talk more about that, because I think that's a good idea. Anybody else have any good ideas?
All right, well, since that looks like it might be it for the questions, please join me in thanking Jason for joining us today. Thank you.
Thank you very much.